Hi, my name is Jennifer Jackson, and this is my Grand Rounds presentation for Rural Primary Care 2. Today we have a 23-year-old male who presents with abdominal pain 8 out of 10 for the last 3 days. He describes the pain as sharp, constant, and aching. He states that the pain started 3 days ago, Sunday morning, when he woke up. He denies knowing anything that he has done recently that would have started this pain. For pain relief, he has tried Tylenol 500 milligrams every 6 to 8 hours for the last 3 days. He states without the Tylenol, his pain goes back up to an 8. With the Tylenol, his pain is a 4. His past medical history includes no chronic conditions. He has never been hospitalized other than a broken bone when he was 12 years old. He reports no recent illnesses in the last 6 months. He's fully vaccinated. He has not been ill in the last 6 months, and he's not been out of the country in the last 6 months. He's currently a physical therapy student at UNG. He is very passionate about a healthy lifestyle and fitness. His family, he states, is not very healthy, so he tries to eat healthy with fruits and vegetables in his diet, a protein shake every morning, and he also takes calcium supplements, men's multivitamin daily, and he takes pre-workout before his exercises. He exercises 4 to 5 times a week, sometimes 6 to 7, depending on the week. He is currently not employed, so he says he has free time to focus on his health. He also drinks 3 to 4 Yetis of water a day. He denies any soda or caffeine use other than 1 cup of black coffee every morning. He denies cream or sugar. He states that he only has fried or fatty foods 2 to 3 times a month and for special occasions. He does not enjoy eating sweets. This past weekend, he didn't do anything extraordinary with his diet. He does not drink alcohol except for 1 time a month with his friends, and then he usually has 2 to 3 beers. This last weekend, he did not have any alcohol. He did not have any fatty foods. He had a test to study for, so he was focused on his test. He denies anxiety or depression or any difficulty focusing in school. He also denies any headaches, dizziness, nausea, vomiting, weakness, joint pain, constipation, diarrhea. He states he has 1 bowel movement a day, and he's regular with his bowel movements, and nothing has changed. He denies any other symptoms other than just the excruciating abdominal pain that has brought him in. Upon exam, he had rebound tenderness, but he stopped me from completing many abdominal assessments due to his pain. He is currently slouched over and doubled over in pain in the chair in the exam room. His bowel sounds were active in all 4 quadrants. He had negative Murphy's, negative psoas, negative Rovsing signs. He did have rebound tenderness in the center location of his abdomen. There's not 1 quadrant that hurts more than the other. He says it's centrally located. He has no allergies. I'm trying to think if there's anything else I want to include. I think that's pretty much it on his history. His family history includes hypertension, diabetes on both sides, type 2, and morbid obesity. He told me about his family, who he states is not very healthy. They all have fried foods every day. He describes their eating as Southern cooking. And that's one of the reasons he's very passionate about his health and why he got into physical therapy, is because he wants people to have healthier lifestyles. So with that, possible differentials include gastritis, cholecystitis, and pancreatitis. However, the presenting symptoms are troublesome because he doesn't have any other coinciding symptoms that would go along with those diagnoses. He doesn't have a fever, although it is hard to tell because he has been taking the Tylenol around the clock for 3 days. His skin isn't jaundiced. His skin looks normal color. His eyes, his sclera are white. He doesn't have excessive alcohol use from what he's telling me. And he has no other complaints. It didn't start suddenly with food. He just woke up with the pain 3 days ago, and it hasn't gotten better. So things that we would want to do include, we need labs on him, CBC with differential, also liver function studies. I would also like to get a CRP, and I believe he needs an abdominal ultrasound to further evaluate what's going on with his pain. In the office, we don't have an ultrasound machine, so that we'll have to send him out. And I think it's best to send him out based on the amount of pain that he's in and for how long that it's been going on. He says that he's mainly been at home staying in bed because the pain has been unbearable. He has difficulty walking because of the pain. And he states on Saturday he didn't do anything extraordinary with his exercises. He doesn't believe it's muscular. So with that, probing my preceptor questions that I'm interested in are if they've seen this before. Have they seen, a gallbladder case or pancreatitis that is pain and only pain in a young male? He's young. He's 23. He's otherwise healthy. He has no medical comorbidities. But his family history has me concerned about GI-related issues. So with that, I do think we should send him to the ER to get evaluated. Selecting an issue on this is hard for me because, I guess just evaluating whether or not patients present with just pain and no other complaints. Because usually I work in surgery, and when we see people that have abdominal pain and they come in and have their gallbladder taken out, they're usually having it after they've eaten mac and cheese or they've had Thanksgiving dinner or something like that. It's usually a female, not male, and they're usually much older than 23 years old. So I find that extremely interesting that this patient only came in with abdominal pain. He didn't have any other symptoms. So with that, without the use of an ultrasound in the office, we need to send him out. The only other concern I really have is if his pain is actually more chest pain related, cardiac wise. We do have an EKG in the office, so we could do an EKG. Yeah, that's pretty much it. Thank you for listening to my TED Talk.